All right, it's 4 o'clock. Thank you for joining us for tonight's webinar on cultural competence in nursing. I'm excited to announce the two speakers we have tonight. First, we have Daniel. He is the faculty lead of the International Clinical Programs here at Joyce University. His past experience includes public health nursing with the Salt Lake County Health Department, inpatient nursing on medical oncology and acute rehabilitation units, and as a dermatology nurse practitioner. We have Hafsa joining Dan tonight. She is currently a nurse practitioner at the University of Utah Urgent Care Redwood Clinic. She has been there for the past 4 years. Before that, she has worked as a nurse practitioner in pediatrics, as well as 9 years as an RN in labor and delivery. I will go ahead and turn the time over to you, Dan.
Thanks, Michelle. Yes, so let me share my screen and we can get this started. Okay, so like Michelle said, we're going to talk today a bit about cultural competence in nursing. Again, my name is Daniel Wakamatsu, and I am accompanied by my good friend and colleague, Hafsa Abdikadir. Again, my work background does include inpatient medical nursing experience involving medicine oncology, acute rehab as a provider with dermatology service, as well as in public health with the Salt Lake County Health Department. I'll go ahead and let Hafsa kind of reintroduce herself.
Yeah, thanks, Daniel. My name is Hafsa Abdikadir. I joined Joyce University, I think, 2 years ago. I'm a clinical instructor. I do take students to Guatemala to do their capstone hours, clinical hours, and I also work at the urgent care. I did work in labor and delivery, predominantly with the African and also refugee and the immigrant population. And I do also work in a most diverse community at the Redwood Clinic. We see a lot of diverse people from cultural and also religious background. In my experience, both in Guatemala as a clinical instructor and also Redwood Clinic, cultural competency should no longer be an option, but also a vital to everyone. That's all I can say.
Yeah.
Yeah.
No, that's great. So Hafsa and I together have taken students to various locations in Guatemala. And I feel like one of the most rewarding things to see is to see these students become more culturally competent individuals, which definitely helps them work collaboratively with each other while caring for those who have very different backgrounds from them. All right, so I'm really happy that Hafsa joined me for this discussion today. She does add a lot of experience and value, especially concerning cultural competency.
Thanks, Daniel.
So our objectives today are to define and discuss cultural competency and the cultural competence continuum, review the importance of cultural competency, address strategies and available resources that may improve one's cultural competence and ability to work with diverse populations. So disclosure here, Hafsa and I do not consider ourselves to be subject matter experts, all right? So we're not social scientists. Cultural competence is indeed a complex area with quite a bit of depth, all right? For this discussion, we have only about an hour, which is definitely not a lot of time to dedicate to this subject. So our objectives that we just reviewed will hopefully get each of you to think about what cultural competency is and provide some resources to help expand on your knowledge and skills as you take ownership in developing your competency, as well as supporting others to do so as well. We will be utilizing some live polling to make this a little bit more interactive in nature and not just have me and Hafsa speak the whole time. So if you can go ahead and take a minute to get that set up on your mobile device or on your computer, wherever you're at. If you're on your mobile device, you can scan this QR code with your phone, with your phone's camera, or you can go to any web browser, including your mobile browser, to pollev.com pollev.com/JoyceCC. Again, that's pollev.com/JoyceCC. All right. You do not need to identify yourself. So on that first screen, you can just skip that. And then you should be brought to kind of that little waiting room where we will kind of start. So as we move through the polls throughout this presentation, it should automatically update, but if it does not, then all you need to do is go back to that website or refresh your browser. Okay. Okay, so for the first poll question, more of an icebreaker, just where were you born? So we have a group of how many different individuals, maybe 15 plus individuals on this call. So just kind of go ahead and tap. You might have to zoom in a little bit and share where you were born. Cool. So a number throughout the US, Canada, Hawaii, Africa, and Europe. That is so interesting because we all were born in different places, but yet in 2023, we are all on this Zoom call having this nice discussion with each other.
Absolutely.
All right.
So, yeah, so on this one, just describe what would be one word or words would describe the culture or cultures you identify with. With this one, it's not necessarily like one culture. You can identify in multiple cultures, such as Asian American or, African or African American, and Mormonism or Somali or whatever. So we'll give a minute to everyone to respond.
I love how Joyce is listed as a culture on there.
Yeah, I like that. Yeah. We have a Yugoslavian, we have an Asian, Irish, Caucasian, European, LGBT. That's awesome.
Cool. All right, so yes, very different backgrounds, multiple cultures here, and definitely something to be celebrated and appreciated, right?
Absolutely.
All right, so move on to the next question. How important do you feel cultural competency is in healthcare?
I like that we're all agreeing it's very important.
Yeah, so extremely important. All right, so no question. Everybody for the most part is agreeing that it is definitely an important aspect in healthcare, especially nursing.
It's awesome. So how much do you feel you know about cultural competency? And with this one, let's be honest. I like that. Okay, so majority of us are a fair bit. And I'm glad we're not highly competent in our cultural competency, because it's always evolving, it's always changing, and it's always room for improvement as well.
Great. All right. And the last introductory poll question is, do you know what the cultural competency continuum is? Okay, yeah. So majority have never heard of it. All right. So we're going to go through the cultural competence continuum during this presentation. And it is a very good continuum or idea to understand, especially as we kind of create an awareness for us as individuals culturally and recognizing other individuals' culture, right? Cool. Thank you, everybody, for participating. Hopefully that was easy for you all to do. And we will move on. So we're just going to highlight a few bits of aspects of diversity here within the US and with this Utah. All right. So this is some data from the most recent census. So this data is from the US Census Bureau. And this particular table describes an increasing diversity index. So the diversity index is the chance that at any point in time, you could pick two random people. And in this case, within this table, they would be of different racial or ethnic groups, all right? So about here, 2010, you can see that the US on a whole, that chance was about a 55% chance that if you took any two people randomly, 55% of the time they would be from different racial or ethnic groups. All right, 10 years later, 2020, that has increased by about 6 percentage points to 61.1%. All right, Utah has modeled that trend as well. 2010, that was a 33.6% chance. And with the most recent data, that's increased to 40.7%. So a 7% increase in that diversity index. So becoming an increasingly diverse nation as well as state. This is also from data from the US Census Bureau in terms of people who speak a language other than English at home. And I was quite actually surprised at this number right here, where in the US, like 1 in 5 individuals speak another language, all right? The other important aspect of data here is those who don't feel like their English competency is very good, all right? So nationally, that's 8.2%. In Utah, it's about almost 5%. So about 1 in 20 individuals don't think that their English language skills is very good. And that's just an important aspect to kind of keep in mind during our conversation today, because communication is definitely an important aspect of providing cultural competent care or working in a cultural competent way. And so individuals will definitely need a bit of support who might struggle with language. Right. Various religious groups in the US. This is data from the 2014 Pew Research Center's Religious Landscape Study, where they telephone interviewed 35,000 Americans on their religious beliefs and practices. So you can see a majority identify as Christian versus unaffiliated, then into non-Christian faiths, including Jewish, Muslim, Buddhist, and Hindu.
That's awesome. So let's go ahead and try to understand what culture is in order for us to understand what cultural competency is all about. So what is culture? According to the Department of Human Health and Services, culture is the integrated pattern of thoughts, communication, action, customs, beliefs, values, and institutional associated wholly or partially with racial, ethnic, or linguistic groups, as well as religious, spiritual, biological, geographical, or sociological characteristic. Basically, culture is a dynamic in nature, and individuals may identify with multiple culture over the course of their lifetime. I do really like the last sentence. Culture do change at all time and plays a very crucial role in shaping sexual orientation or identities, our behaviors, and also our perception. We now see women that are now in the workforce services, and also gender roles have completely changed. Now we also see men who are cooks, are chefs, or we see women now are in construction, okay? So culture is also influenced in many things, such as race, nationality, sexual orientation, physical disability, or sometimes physical characteristics, education, whether it's health literacy education, and also social economic status. So it's always evolving. Like a person, I mean, I can give an example of myself. I don't just identify myself as one culture. I would say I am Black, I am African, I am African-American, I am Somali, I am a Muslim, and I'm a woman. So I have multiple culture within my own culture itself.
That is a great explanation. Thank you, Hafsa. All right, so moving on. So we've kind of just defined culture. So what is cultural competence? All right, so there are many different definitions of what cultural competence is. So we're just going to provide a few examples here. All right, cultural competence can be defined as a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals and enable that system, agency, or those professionals to work effectively in a cross-cultural situation, in cross-cultural situations. The American Nursing Association describes cultural competence as being represented by the process which nurses demonstrate culturally congruent practice. Nurses design and direct culturally congruent practice and services for diverse consumers to improve access, promote positive outcomes, and reduce disparities.
So basically, in another word, so in a simpler term, cultural competency, it's the ability to work effectively with people of various cultural backgrounds. There are also like 6 components in cultural competency. These are cultural awareness, cultural knowledge, cultural skills, cultural encounter, and also cultural desire. So I'm going to go ahead and kind of give examples and also talk a little bit more on all the components. For example, with cultural awareness, it's acknowledging your own biases and also your own attitudes, and your own cultural background can impact someone's health or even someone's life. And also cultural knowledge is whereby improving or understanding about various culture and how their background might influence might influence your care or how you care for them. And cultural skills is being able to interact with others of various cultures and beliefs, listening without judgment, asking questions without being judgmental or offensive, or being prepared to overcome language barriers by providing appropriate or approachable environment. Cultural encounter is directly interacting with diverse individuals or communities to develop knowledge and skills. And lastly, cultural desire is motivation to learn about other cultures and accept and understand their differences, not being forced to learn or interact with others. So you just have that desire to learn someone's culture. And we'll go ahead and talk about them as we go about cultural competency throughout this PowerPoint.
All right, another poll question. All right, so what are your thoughts on what undesired effects can a lack of cultural competence lead to? So this could be nursing specific, healthcare specific, or anything in general. If your poll has not refreshed, then you can manually refresh the screen if it's still stuck on the previous question.
Then see if you can try and refreshing as well. Okay, there you go. Yeah, I like the mistrust, medical errors for sure.
War, yep.
Yeah. And also health disparities, you know, like afraid to seek healthcare.
Absolutely, absolutely. Okay, so let's move on here. Okay, so patient safety is often a topic that is prioritized in healthcare. So we did not do an extensive review of the literature for this presentation, but did identify an article that itself identified common themes that may affect healthcare safety within minority communities, right? And we think that these themes resonate as items that as culturally competent providers or individuals, we should think about when caring for others, right? So these themes come from a systematic review published in 2020 in the International Journal for Equity and Health. And we'll just go through the themes below. All right. So a language proficiency. So when you're caring for somebody, it's would be good to identify if there's any concerns for possible things within language proficiency that might result in adverse effects or incidences. So limited English proficiency patients are individuals who are unable or have limited ability to read, write, or understand English. All right. So definitely they can be limited in terms of understanding the language, looking up a schedule that's in English, or navigating care from a system with their services that are all published in English, right? Another theme is errors associated with formal and informal interpretation. So just highlighting the importance of using professional interpreters rather than caregivers or family members, which may limit communication. So Hafsa and I have definitely seen this quite often in Guatemala, where children, like a child who's 10 years old, who does speak Spanish and some limited English, is translating for their parent, right? And there are a lot of limitations in that, because a 10-year-old is going to have a much so limited scope in language, especially when describing medical issues correctly, right? Hafsa, do you have anything to add to that?
Yeah, or even sometimes like using family members can also, they can also like maybe choose not to share like a diagnosis with their family members, and which can later on be detrimental. Instead of like fixing it now, they're completely like reserved not to interpret, like, let's say, a cancer or diabetes or hypertension to their loved ones. So it's very important to use a formal interpretation, especially people that are qualified to interpret rather than family members.
Yep.
Do you agree?
Yep, I definitely agree with that. So going on to, are there concerns if the individual is going to have any problems interpreting instruction? So is there going to be any misinterpretation potentially of instruction? So this might include the inability to read prescription labels, right? Not fully understanding discharge instructions. So there are some cultures which will look at nurses or healthcare providers as authoritative figures. And when those people are giving discharge teaching, the patients might just say yes to everything. Like, yes, they understand, even when they don't. Hafsa, have you seen this in your practice before?
Yeah, and a good example would be there was a Somali patient who was instructed to give out they were trying to test him for TB and see if he's able to like be in the community or rather than in a hospital setting. So the health department instructed this patient to collect the first morning sputum, but they used an interpreter, a family member interpreter, where completely was misinterpreted in terms of like, instead of telling the patient you need to collect the first sputum, they interpreted as if that they were asked to sniff the container every morning. So when they went back to the health department, they're like, oh, no, that's the instruction that you gave us, and rather not spitting on the sputum. So we see this a lot, both in the urgent care and also going to Guatemala. And that's Dan and I have started using the teach back method when we're either prescribing medication to the Guatemalans or even Hondurans patient. We always ask them to teach back again, like, so that we make sure that they have understood the instruction to reduce errors and also compliances.
Yep, teach back method we definitely use a ton. And it is astonishing at how many people do say that they do understand your teaching while you're doing teaching, but when you have them teach back, they don't, right? So definitely a way to ensure that people have a concrete understanding. Right.
And this doesn't go, Daniel, only on non-English speaking individuals. It can also go to the people with low literacy level. You know what I mean?
Sure.
People that have not had a formal education, Americans who have not had a formal education, we need to use the teach back method so that they understand and know what they're taking and what to expect in terms of side effects and so on and so forth.
Absolutely, absolutely. All right, the next theme is income insurance. So thinking about as a caregiver or provider, are there any concerns for this individual in terms of income and insurance? So studies have found that a higher incidence of adverse events was seen in low income or Medicaid patients and is higher than those who are at a higher income level or with private health insurance, right? So lower socioeconomic individuals may not be able to access care or might delay seeking access to care, which in turn would result in poor outcomes. And Hafsa, I think you have another great example of this.
Yeah, so in the urgent care, we always see the either uninsured or underinsured, and majority of them that we see at the urgent care, like Medicaid patient, where let's say a patient comes in with a tooth abscess or like a tooth fracture or cavity or any issues related to the teeth. Medicaid does not cover anything to do with dental. So a patient comes in with a dental abscess, we do prescribe medication, but we always recommend that they follow up with a dentist. So nowadays, what we do is we provide them with resources such as low-cost dental areas or free areas, dental places that can provide free dental work, or even the sliding scale or anything relating to their income. So it's very imperative to know that sometimes patients who lack insurance or even lack access to healthcare because of they cannot afford can be detrimental later on in life if they cannot fix it now, which is like to you and I would be like a small issue, but to them it's a huge where cost is involved in this as well.
Yep. All right. Next theme is beliefs about illness and treatment. So differences in beliefs may impact things such as medication compliance. So if a particular culture or religion has a time where the individual is fasting, that could in turn have make the individual feel like they don't take their medications at all during that time. All right. There's also potential for present moment thinking, where individuals may think that they only take their medications when they're symptomatic. So if they have a UTI, once those symptoms are gone, they're done with the antibiotics, right? Which we know is not the case. Same thing with hypertension. If they have a headache, they'll take their hypertensive medications. Otherwise, they might not think that it's necessary to do so. So this kind of all goes back to health literacy and encouraging that for everybody and making the time and effort to make sure people have a good understanding about their illness and treatment. All right. Any concerns for family and friends in regards to safety diligence? So it is important to include family members in care. All right. So individuals may stop taking medications or seek alternative treatment based on just advice from family or friends, right? And that might include taking alternative treatment that might not be effective, right? Because perhaps they really trust or rely on their family and friends to offer some kind of empowerment or direct them into how they care for themselves. So Hafsa, do you have any thoughts on that?
Yeah, this one I can give so many examples regarding this one. A good example would be like, let's say Dan and I come from the same background or even from the same culture. We see each other in the community. Both of us have hypertension. Dan was prescribed lisinopril prior to me being prescribed the medication. So Dan experiences, let's say, facial edema or side effects from lisinopril. What does Dan do? Dan stops, calls the provider and says, hey, I don't want this medication. It has caused me so many grief. And then Dan finds out that I am also prescribed lisinopril So what does Dan say? Oh my gosh, stay away from this medication. It's so detrimental, do not. What would I do? I will listen to Dan because Dan has experienced the side effects. So Dan has influenced me not to take the medication. I see this quite a lot in the community. We do also see it in labor and delivery, where we have the mommy blogs where people seek advice in the internet. Do not take them, don't accept anyone to give you epidural, or don't have an IV when you're going in labor, or I delivered at home. It was safe to deliver at home. There's so many things that as individuals we're prone to, like giving other people's our experiences, and not knowing that one size does not fit all. Your experience might be completely different than my experience. So goes back to, it does damage, then does good to our society.
Yep. All right, and finally, the last theme that was found is the patient-professional interaction. So if a healthcare provider has bias or an attitude that holds their patient in a negative light, that could have detrimental effects to any patient's kind of health or well-being, right? So an example is a Muslim woman arrives into the clinic, and the staff there does not offer, or very much so resists, their request to see a female provider, right? So that interaction in itself can affect that individual's future relationships, not only with the individuals who are resisting care or resisting finding a female provider for that patient, but also affect the relationship with that facility, right? Or relationship with medicine or healthcare in general, and kind of have avoidance, avoid seeking medical care based on that kind of interaction. And Hafsa, I'm sure that you've heard a lot of stories based on that.
Absolutely, Daniel, absolutely. And that was a good example when you mentioned that, the Muslims and also the Asian population they prefer not to have a male provider, but instead a female provider. So we all know that most anesthesiologists are male. So a laboring female patient who prefers a female provider might opt not to get an epidural because the anesthesiologist is a male, later on ending up with longer labor time, and also being tired of the labor process and not able to bond with their babies. So that was a good example, Danielle.
Great, thank you. All right. So moving on to the cultural competence continuum, all right? So this continuum is based on the work of Dr. Arthur Kleinman, who is a psychiatrist, and there are varying degrees. The thought is that there's varying degrees of cultural competence, ranging from cultural destructiveness all the way up to cultural proficiency, what we should all kind of strive to be at. All right, so we're going to go ahead and describe each of these places on the continuum. So cultural destructiveness, it's the attitudes, policies, and practices that are destructive to or eliminates another people's cultural groups. So this is probably the most easy to detect and most negative end of the cultural competence continuum. So extreme examples would be genocide, the Holocaust, genocide in Rwanda, Cambodia. Could be somebody refusing to hire or work with a Muslim or deaf individual. So kind of that elimination of a cultural group.
Or even a good example, Daniel, would be during the pandemic, during COVID, the pandemic, where the Asian populations were being attacked as if they're the ones who are responsible for the COVID pandemic. So yeah, could be a very detrimental destructiveness, trying to think that your own culture is, up here compared to any other cultures that you come across. So you're trying to eliminate that cultural group based on your personal beliefs and your own assumptions.
Yep.
And then with cultural incapacity is the belief in the superiority of one's culture and behavior that disempowers another culture. With this one, a good example would be not utilizing interpreters for patients, or saying things like, you're in America now, you need to speak English. Okay, or not recognizing other holidays, just your own holidays in either a health setting or an office setting, or thinking that the best family consists on a mother and a father and children, instead of now we have father, mother, or a single parent, or two dads or two moms, and so on and so forth. So it's just kind of putting your own differences and and also your own culture aside, and not thinking that your own culture is superior than the other culture.
All right. The next level on the continuum is cultural blindness, right? So this is ignoring existing cultural differences or considering differences inconsequential. So viewing and treating all people as the same. And I think this happens fairly common, right? So I guess an example potentially, so I could think that, well, I see Hafsa's Black, so she definitely celebrates Kwanzaa, right? Just assuming that she is all Black people celebrate Kwanzaa, right? Would that be a fair example?
I know, or me assuming, Daniel, because you're Asian, you should know math, or you should be good at math, and we all know you're not good at math, right, Daniel?
Right. Depends sometimes, right? But yeah, that was in high school taking calculus, and people asking me questions about math equations that I did not understand myself, just because and thinking that I did just because I was Asian. That was pretty striking, right? In an academic setting, this could be us treating all students as the same, regardless of their abilities and background, which we know is definitely not true, right? So I come from an Asian background where it was similar to like I would speak if I was spoken to, right? So developing new thought on the spot in an interactive classroom was definitely a struggle for me, especially in undergrad, as I learned how to more effectively take on that skill, versus in the past, like definitely give me a task, right? I will write it and hand you back that work later on in the day or the next day, right? So people do learn differently. So just recognizing that. Hafsa, what other things do we have?
I do have a good one. In the urgent care, like we have the tendency of telling our patients, follow up with your PCP. But in the refugee or even in the immigrant populations, they don't have a PCP. A PCP is like a general doctor who takes care of everything. So we've kind of understood when we know that they will not follow up with PCP because they don't understand what PCP is. They don't understand the American healthcare. So literally we walk them to the front desk and we schedule an appointment for them to see the PCP. So that's a good example. Not everyone understands the American culture, and we shouldn't be assuming that all of us do understand the American healthcare, but we should take that initiative of making sure that all of our patients understand what a PCP is and what it means to follow up with your provider.
Sure. So in that case, I think you're saying that they would regard you as their PCP and not somebody else. Okay. Yeah. Yeah.
Exactly.
And
definitely
the
dentist. I am the the doctor. But no, I'm only an urgent care provider where I will take care of what is urgent right now. But your diabetes, your hypertension, you need to be following up with your PCP in order for them to manage your care, but not the urgent care.
Yep. Yep. A final example, I think, would be providing everybody with written education handouts in English without assessing their language or their even English literacy, right? Just blindly thinking that everybody, if you give this piece of information, they'll be equal in understanding, right? Which we know is definitely not the case.
Or even Daniel, giving somebody just because they speak Spanish and you're giving them the documents in Spanish doesn't mean that they're literate even in their own language. So that's one assumption that we also have as providers. Just because a patient speaks Russian, I will provide documents in a Russian, you know what I mean? Not knowing that is he competent or is he even literate in his own native language? So we
Right.
have to be mindful of that as well.
Yep.
Okay, and then with the cultural pre-competence, it's the aware of the limitation of one's skills or organization practices when interacting with other cultural groups. Individuals try to use appropriate behavior and practices while recognizing they still have much to learn. With this one, I think we all fit in this, majority of us, like the cultural pre-competence. As for me, working in labor and delivery, I was exposed to so many cultures. And the one thing that I noticed was the Asian and also the Hispanic community, once they deliver, they prefer not to have cold beverages. I knew they didn't prefer that, but I never understood why. But I made sure that they had a warm beverage instead of a cold beverage. So this would be a good example of cultural pre-competence. How about you, Dan?
Yeah, I think another thing that might be kind of timely appropriate as well is that if I were to kind of be aware that it's Ramadan, and I know that Hafsa is participating in Ramadan, and it does mean something to her, but I don't know yet exactly what that is, but I do recognize that I should at some point learn more about it. All right, so moving to cultural competence. All right, so on the continuum, cultural competence could be defined as any policy, practice, or behavior that includes acceptance and respect of differences, carefully attend to the dynamics of difference, continually assess their own cultural knowledge and beliefs, continually expand their cultural knowledge and resources, and variously adapt their own belief systems, policies, and practices. So I guess in a more simple phrase, cultural competence is respecting and actively expanding your knowledge of others. All right, so moving on from that last example, with me, I could in turn build upon my lack of knowledge with Ramadan, and I could go up to Hafsa and say, Hafsa, I know it's Ramadan, but I know very little about it. All right, can you tell me what it means to you, and what does it entail? Right, so that could be an example of cultural competence.
Yeah. Oh, how about me asking Daniel, like I've heard about the Stonewall riots. How do this relate to the LGBT Pride Month? You know what I mean? So I'm actively trying to understand and also seek knowledge on what it entails. Okay. Or even this is the one thing that I always struggle with is Christmas. So I know there's like exchange of gifts during Christmas because I don't celebrate Christmas. I do understand there's the exchanging of gifts, and I don't know the meaning behind that. So this is a good opportunity for me to ask, like, why do Christians or why do everyone exchange gifts during Christmas? Or what are the significance of the colors of green, red, and gold in Christmas? So this is where I would take, time to understand and also seek knowledge about that as well. And with cultural proficiency, may not know all there is to about others who are different from them, but they know how to take an advantage of teachable moments, how to ask questions without offending, and how to create an environment that is welcoming to diversity and to change. Here, this is whereby you start asking the why in a very respectful manner without being disrespectful, and you're actively taking an advantage of learning opportunities, like what Daniel was saying earlier. He knows that I fast during Ramadan. So what does that entail, Hafsa? Like what does that mean to you, or what does it signifies in your culture or in your religion? Or even being proactive by helping advocate for cultural awareness, and also providing teaching materials that is available in multiple languages or literacy level, or even holding everyone's culture in high esteem. So not just celebrating one culture, but celebrating all cultures during the holidays. Let's celebrate Kwanzaa. Let's celebrate Diwali. Let's celebrate the Jewish holiday. Let's celebrate Christmas. So not just one celebration, but a celebration of everybody's culture.
Great. So those are the descriptions of cultural competence, of the cultural competence continuum. So last poll question, I promise, the very last question. So everybody on the call, where do you think, given these descriptions, do you fall on the cultural competence continuum, right? And remember, your responses are anonymous. And to refresh your poll, if it's still stuck on the previous question.
Nice.
Okay, so about half and half around cultural pre-competence and cultural competence, which I think are good places to be. So our next slide, going back in more detail on the cultural competence continuum image. All right, so this slide we've added kind of arrows between the different stages or different marks of the cultural competence continuum. All right, so it's important to remember, for all of us to remember, that our place on the cultural competence continuum is not set in stone, right? It's not something that we master and forget about. It requires continuous effort and awareness of one's attitudes, desire to learn, and application of skills, right? So all of us can definitely progress or regress on this continuum and at any point in time, right?
Daniel, if I can put myself on the spot here,
Sure.
So I always believe that I'm either between pre-competence and competence. But a good example would be an incident that happened in Guatemala where I had a patient who was 17 years old, and she had had a baby, let's say last year, and she was actively trying to get pregnant at 17. She had no way of taking care of the other baby. She does not have enough food. Shelter was an issue. She was living with family members, and she didn't have enough education. Like she was just like a 5th grade level dropout from school. And I used one of our student who lived in Guatemala and understood the culture in Guatemala to interpret for me. And my first instinct was, why are you getting pregnant? You're 17. You should be on birth control. And you should also be thinking of, taking care of, you have a life ahead of you. And I got a reality check from my student, and he was like, Hafsa, I don't feel comfortable interpreting this. Like, have you asked the patient why it's important for them to be pregnant? You know what I mean? What it means for them. And like what Daniel is saying, the cultural competency continuum, it's not set on stone. By all means, you can be culturally blind one time, you can be competent the other time. So it goes back and forth. So it's a continuous process of us learning and trying to improvise and improve our cultural competence by putting on check on our biases, our stereotype, the way we think that, I'm planning my babies. I expect everybody should be planning their babies. You know what I mean? So those are the things that we should be mindful, instead of like coming in a biased perspective. We should always be culturally sensitive. What does this mean to you? Can you explain what this entails to you? What does this mean in your culture? And so on and so forth. So yeah, thanks for letting me explain that, Dan.
Yeah, no, I think that's great. Those are really valuable open-ended questions to have, and ones that definitely will take up more time during a visit, but would be invaluable.
Absolutely.
All right, so we're going to start to wrap up the presentation here. I know it's getting close to time. So just going back to the slide that we had earlier on what is cultural competence. So if anything, if you take anything away from this presentation, it's kind of to remember that in simple terms, It's the ability to work effectively with people of various cultural backgrounds, all right? If you have a better memory, like remember the components include cultural awareness, knowledge, skills, encounter, and desire, all right? So encounter and desire, those are definitely aspects that you as an individual are gonna have to take solo ownership of that, because nobody, Hafsa or I, nobody can force you to be motivated to learn about other cultures or force you to participate in interacting with a diverse group of individuals, right? So hopefully we have kind of made you think a little bit about all these aspects and provided you with some thoughts on how to improve your cultural competency. All right, we're gonna finish up with providing some recommended resources that will help kind of build on your knowledge and skills. So we kind of selected 4. There's a lot out there, you can find a lot, but these we felt would be pretty good in various aspects on helping anybody kind of get off the ground and become a more culturally competent individual, right? So the first is cultural religious competence in clinical practice. And this is a CME activity from StatPearls, I believe, but you can access it on PubMed for free, all right? So the link is right there. And this document describes various religious beliefs that may affect someone's view on health and healthcare, all right? Another great resource is the Cultural Sensitivity Pocket Guide for Healthcare Professionals. And this is produced by the Joint Commission, all right? So it's really only available at cost for physical copies, but if you search hard enough, you might be able to find an online version. But you can definitely buy it from the Joint Commission store there. And it provides some pretty awesome, concise detail on cultural considerations for various ethnic and racial groups, right? The Department of Health and Human Services, Office of Minority Health, they do have a actually phenomenal learning activity titled Culturally Competent Nursing Care, a cornerstone of caring. It does give you 9 CME credits if you do complete it, and it can be accessed at this link, all right? And it goes into great detail on things from how to improve your self-awareness, ways to effectively communicate and work with others, and how to be an advocate from a personal and organizational standpoint, right? So it goes into a lot more detail than we're able to provide on this presentation. And then I'll let Hafsa talk about the last one.
So the Aftershock documentary is very impactful, and I urge everyone to watch it. You can find it on Hulu. It's a documentary about maternal health disparities among Black women in America. The documentary basically follows 2 African-American male whose partners died during childbirth complication, which were very preventable. One died of PE and the other one died of, I think, HELP syndrome, and something that could easily be preventable, especially in a much resource country like America. It also talks about how Black women are 3 times more likely to die from pregnancy-related cause than white women. The multiple factors contribute to these disparities that were mentioned in the video was the variation in quality of healthcare, underlying of the chronic condition, structural racism, and also implicit bias. And I also read in CDC that this was very alarming. The maternal death in African-American or Black women was 44 per 100,000 live births in 2019, then increased to 55.3 in 2020, and now it's at 68.9 per 100 births in 2021. Those numbers are very discouraging and yet so alarming in the way we care for our women. So as you all know, that women's health, I'm very passionate when it comes to women's health, and I would love for you to just kind of take I think it's a 2-hour documentary, very, very educational and also alarming. So it's a good documentary to sit down and watch as well.
Yeah, I would agree. Just clarification there, that is per 100,000 live births. So
100
most recent data, 68.9 per 100,000 live births. Right?
Instead of decreasing, it's increasing. So it's just like, what are we missing here? Is it our own biases? Are we still fixated in like, oh, are you using drugs, or Black women are not able to experience pain? So it's quite alarming. So I don't want to I don't want to give you all the details, but it's such a good documentary to watch. So it's on Hulu.
Yeah. All right. So that brings us to the end of our presentation. So I guess, Michelle, if we can open up to the Q&A if possible, I'll go ahead and end the slideshow. We have like 5 minutes of time, so I apologize for not allowing so much time for questions.
Perfect. Thank you. I want to be the first to say thank you, Daniel and Hafsa. That was an amazing presentation. I've learned and grown and experienced growth through this. And I'm also going to plug the Aftershock documentary. I recommend it. It is very insightful and full of knowledge gaining opportunities. All right, we will go ahead. It looks like, there we go. If people want to put questions in the Q&A or in the chat, we can go ahead and read those to Daniel and Hafsa.
So I might start off while there's a bit of silence here. So Hafsa, you are a refugee. So I'm wondering if, I guess when you came to the US, were there any instances of or examples of cultural competence or lack of cultural competence that really, I guess, kind of affected you?
I think, yes, when I was working as a labor and delivery nurse in labor and delivery, we did have quite a number of patients coming from various backgrounds, like Somalia, Sudan, Asia, Middle East, and majority of them were of female circumcision. And female circumcision is very common in other countries than the US, and I don't want to get into details why they do that, but there are various types of circumcision. There's like grade 1, grade 2, and grade 3. The majority of the ones that we used to see in labor and delivery was grade 3, where they take the two labia and attach them together and leave a small hole for just menstruation and also intercourse. So there's a lot of health complication regarding female circumcision, from like dialysis to kidney failure to what have you. And then majority of the women that would come to labor and delivery would have a note from their provider stating that, hey, I am a female circumcised patient. If I'm in labor, please call my provider. You cannot, or you will not be able to check my cervix. And then I happened to be the primary nurse at that time, and I do speak Somali and Swahili and a little bit of Arabic. And a patient walked in with that note, and the charge nurse took the note and kind of just was very insensitive with the way she handled that situation by saying, like, how do they get pregnant? Through their rectum? To me, I was like, this is insulting. Not only is it so insensitive, and I could have chosen the path of fighting back or reporting it, or just being resentful towards the nurses that were engaging in that conversation. But I rather took that as a teaching opportunity. And I went to my supervisor at that time and also the nurse manager and said, hey, we need some education regarding what female circumcision is all about. And she challenged me. She goes like, why don't you come up with the educational piece? And I took that as a challenge, and I did end up creating a PowerPoint and also cultural awareness about what female circumcision is all about, what the health implication arises when female when women are circumcised, and how is it impactful, and how can we take care of this patient in a labor and delivery setting. And the other thing that came out of it, we held a lot of symposium and a lot of seminars, not in just labor and delivery. We ended up doing in birthing centers, we ended up doing in breastfeeding center, doula. I mean, it was so impactful. And I go back and use that as an example because you can choose different ways. You can be resentful, or you can choose that as a teaching opportunity for your coworkers and educating them that, hey, this is culturally insensitive that you just said, but let me educate you on why they do the practice and how can we as nurses or even healthcare providers approach this situation in a very sensitive way. I hope that maybe was a good example, but too extreme.
Oh, thank you, Hafsa. We have a question. The documentary is called Aftershock. The next question is, how can I do a better job of teaching my children about cultural competence?
Yeah, that's a good question. So I don't know, maybe I'll answer mine, and then Hafsa actually has kids, so I'll let her kind of expound on that. I mean, I think just exposure and being comfortable in different environments. So definitely avoidance of other cultures is not going to help your kids, especially as they grow up and interact with a lot of other individuals. We do see this when we do take our students to within our international clinical experiences. Like, you can definitely tell those who have not been exposed to other cultures or people that believe different than them. And at first they might be a little bit uncomfortable, but as they get more exposure and talking to people, right, and then asking questions, right, so the 5 components of cultural competency, right, they blossom, right, and that's when they really thrive. They work well with each other, and they're strong performers. So I guess just kind of that those meaningful exposures to other diverse communities. Hafsa, what do you have to add to that?
Yeah, I would agree. Exposure is the key. As for me, like my kids and I don't celebrate Christmas. We're Muslims, but they always ask, but mommy, why don't we celebrate Christmas? You know? So we ended up borrowing a book from the library and we learned about Christmas and what signifies is Christmas and what Christmas means to the Christians. And also we do exchange in my neighborhood gifts. So I do participate in that, yet I'm also educating my kids and myself that let's celebrate everybody's culture by teaching them who they are and how are they different from us, and how can we participate in embracing their culture as well as at the same time also they embrace my culture. My neighbor knows that I fast during Ramadan. She always leaves goodies outside my door, so she knows that I do fast during Ramadan. So things like that has completely created a good awareness and exposure to different cultures. So I do agree with Daniel, exposing yourself and your children to different various type of cultures.
Awesome. One more question. And I think, Daniel, you kind of addressed this in your previous answer. How do students embrace cultural competency when engaging with others during their international clinical experiences?
Yeah, so so kind of expanding on what we talked about a little bit earlier, is that some of them thrive right off the bat, right? And some of them really struggle. But in an environment where you are sharing a room with like 4 or 5 different people, right? And you're around the same individuals almost 24/7, essentially, like it really forces students to kind of sink or swim. And thankfully, for the most part, everybody's kind of swum and thrived in that environment. So they have really kind of embraced that a lot better than I would have thought. I think we've done, as we've taken these trips, we've learned how to kind of prepare students for that shock and how to maybe think about not only themselves, but what other people are thinking, and to have those conversations instead of holding things in and not asking questions and then kind of making things up in their mind, right? So it has been phenomenally engaging with students in terms of increasing their engagement with others, collaborating with their peers, volunteer providers, Guatemalans, their patients. So in general, it's been great.
Awesome. And then Hafsa, we have one question. Why did that 17-year-old want to get pregnant?
It's like it symbolizes fertility in their culture. So the more kids they have, the more fertile or blessed they are. So we ended up finding out that it's more like regarded as fertility for them. It's just a prideful fertility. Yeah.
All right. Well, that is all the questions. We have a lot of thank yous, a lot of great presentations. I've learned a lot. I agree with all those comments. Daniel and Hafsa, you guys did a great job, and I too learned a lot, and I appreciate the experience to facilitate tonight's webinar. Do you have any final comments before we go ahead and close?
No, thank you for having us, and let us talk.
Yeah, it was a good opportunity for us to learn and to be aware what cultural competency was all about, not just learning about somebody's culture, but there's so many things that entails in cultural competency. So thank you for allowing us to research and present it as well.
Thank you. Thank you, everybody, for attending. I believe this is recorded and will be posted for future use and to share with colleagues and classmates. Thanks, everyone. Have a good night.
You too. Bye.